Now let's talk about illness scripts. Illness scripts are a way of organizing the information that you learn from textbooks in a way that you can use it to apply to the patients that you see when you want to determine if they have a particular diagnosis or not. You can use that to compare the information that you get from the patients and match it to how your patient is presenting. Illness scripts also include your past experience with similar patients with that disease as well. And so it includes a lot of things. And so we may not actually consciously do this in our heads, but this is a way of formalizing what we do so we can explain it to you. It takes years and years and years to develop these illness scripts, but you may as well start now. Okay, so the goal of this talk is to talk about how we connect the knowledge that we get from book knowledge about diseases to information that we get from our patients. And we combine those two things in our head through clinical reasoning to come up with a diagnosis and treatment. And the way that we do that, part of that process, it involves creating illness scripts for diseases. Now, an illness script is a way of organizing the information that we have about a particular disease. And it includes various features that we're going to talk about. Now, we may not consciously construct these tables in our head. We may do it unconsciously. But it takes years and years to develop these. So I'm going to formalize the process a bit here in this video so that you understand what we're doing and hopefully get you thinking like a doctor faster. Okay, the other thing that is in an illness script is information from past patients. So you may have patients that are presenting with the same complaint or the same disease, and all the things that those patients have end up going into your illness script as well. However, early on in your career, you haven't seen many or any patients, so you're not going to have these yet. But as you move forward in your career, you will, and you will be adding those to your illness script. So you take the knowledge from books, put it in an illness script, and you store it in your brain. So if we have someone that we're worried about migraines with, we have this information for migraines in here. And there are other illness scripts in your brain. So you can see here's intracranial bleeding as well as meningitis. And so the trick is when you have someone who's presenting saying that their head is pounding, you translate this to mean that they have a headache. And now you have to go and pull the appropriate illness scripts from inside your head. And the best way to do that is to interconnect these illness scripts so that whenever you have someone with a headache, you pull up all of these things together. And so this interconnected network of illness scripts are going to help you compare and contrast various diagnoses that may present with headache. So let's talk about what is inside of an illness script. And there's various components here. So pathophysiology is what causes the disease. Epidemiology is who commonly gets the disease. So these are the risk factors. So if the who of your patient matches the who of the disease in the illness script, then they're maybe more likely to get this disease. Time course is how long it's been going on. Signs and symptoms are the information that you would collect from the history and physical. And the diagnostics are the results of testing. What would you expect to see on testing? And it's good to store in there the treatment as well, how you would treat this disease. Right, so here is, you can see illness scripts for the 3 different diagnoses we had in our network of illness scripts in our head. And we put them together in this illness script table. And this allows you to compare and contrast the different diagnoses that are presenting with headache so that you can compare them against what your patient is presenting with. So again, here's the components of the illness script. And if you want to pause the video at this point and take a look at this, please feel free. And here's an example of an illness script for migraines. All right, and so I just wrote some stuff down here. So the pathophysiology is unknown, but maybe it's some genetic factors affecting blood vessels or neurotransmitters in the brain. Epidemiology, females get it more than males. And maybe and this is the age group, the 30s. The time course, it's acute onset in hours to days, meaning it's not lasting for months at a time, it's lasting for hours to days. And it starts with an aura, which is this sensation patients have that they can tell when it's coming on, then they get the headache. And then afterwards they get this post-stromal syndrome. What signs and symptoms do they have? What would you see on history and physical? Well, they might have a throbbing headache on one side of their head, may have some nausea and vomiting. They may have phonophobia or photophobia, that is sensitivity to light and sounds, worse with stress. Other things can make it worse as well. The neurologic exam is usually normal. Now, sometimes it can be abnormal, but usually it's normal. There's usually no diagnostic testing that we need, and here's a bunch of medications we can use in treatment. So what's the best way to store this info? We take our book knowledge and we store it in an illness script, right? And if we have more than one diagnosis, we store all of them in an illness script table so that we can compare and contrast. So now here is an illness script table for headache, including the migraines that we had before, but also meningitis and intracranial bleed. And you can see now that we can compare and contrast these disease processes against what our patient has. So how do we use this? All right, so let's take a look. And I've put the diagnosis here in this Venn diagram. All right, so if a patient has a symptom that is common to all three, like vomiting, this is what we call a non-differentiating feature. And it really doesn't help us, because if someone is vomiting, it doesn't help us decide which of these that they have, because all of them can present with vomiting. If a feature that is common to only two of the diagnoses is called a differentiating feature. So in this case, someone who's confused probably doesn't have migraines. And a key feature is specific to only one of them. So in this case, fever is only common with meningitis and not with these two diagnoses. So meningitis becomes more likely, intracerebral bleed and migraines becomes less likely. Finally, a rejecting feature is something that if the patient has this, then they probably don't have the disease. So let's say normal spinal fluid, you can see here. It's usually not present in meningitis. So if the patient has normal spinal fluid, they probably don't have meningitis. Now there's an important note down here that there are exceptions to every rule in medicine. So can a patient have normal spinal fluid and have meningitis? Absolutely they can. They usually don't, but they can. And so I'm letting you know that because not everything is 100% in medicine. And as you go through your career, you'll find out what those exceptions are and how you deal with them. Let's take a look at our illness script table and go through those things again, right? So here we have vomiting that is present in all three diagnoses. That doesn't help us differentiate what our patient has. So this is a non-differentiating feature. A differentiating feature here was confusion. It's present in two of the diagnoses, but not that third one. So it helps us increase the probability of those two and decrease the probability that our patient has that third one. A key feature is present in only one, in this case fever, for meningitis. So meningitis becomes more likely in our patient if the patient has fever. Finally, we had our rejecting feature. If the spinal fluid testing was normal, we said it's probably unlikely they had meningitis, right? Because we said they must have abnormal spinal fluid testing. Again, remembering nothing is 100%. So an illness script helps us look at one disease, and it gives us a way to organize the information. An illness script table helps us network various diagnoses so that we can compare and contrast them. And that is going to help us when we come up to patients and want to try to figure out what they have. And so building an illness script table is very important. So when you are studying, it's important to organize information. Try and organize it in an illness script so that you can think about, if I were seeing a patient with this disease, what information would I need to find, would I need to get in order to prove to myself that this patient either has or doesn't have this disease. And then by putting it in an illness script table, you're able to compare and contrast, figure out the differences between various diseases. Again, try to identify key features and rejecting features as well. And that's it for illness script tables. If you have any questions, please feel free to let me know. And thank you for watching.